Hey, so many people who are dealing with back pain, a lot of times they have an instability in the pelvis. And this is due to a lack of strength of the muscles that support the pelvis, the low back, the hips, etc. That's why Back Pain Relief for Life helps with all of that, but there's other aspects to it. And typically we start people off who have back pain with Back Pain Relief for Life, and then we just expand on that. And so this video is going to be expanding on that and things that you can do that will help with stability overall. And this will help with your mental aspect, because remember, the brain is where all the information is coming from, right? You're sending impulses from your brain through thoughts, through the nervous system, and then it's going out into the recruiting muscle fibers through motor units that actually activate and pull on the muscle fibers. So it's all coming from the head, so this will help with mental clarity, mental focus, as well as just anti-aging, because the more you activate these neurons, the better off you will be, and that's why fitness is so important. So the back program is the stepping stone to that, right? Because people aren't thinking about working out. At my training facility, people come to us, the last thing they're thinking about is actually exercising and working out. But we start them off with back pain relief, and then they realize, like, wow, I actually enjoy exercising. I notice I'm getting actual weight loss and some results. And then that's when we take them through a training process that's adapted specifically for them. And then the rest is history, because we have people stay with us for, 5, 6, 7 years after that, just training. Because when you see back pain go away, your life changes. And then when someone takes you by the hand and guides you through the training process in a way that makes you leaner, toner, more energy, stronger, less pain, etc., then the changes can be profound. Like I'm talking about, like, just life-changing. As most of you already know, so I'm just going to go through some basic things here. And so the first thing I'm going to talk about is stability. So once you can kind of see if you're stable just by standing on one leg, right? How do you wobble? Are you able to stabilize here and just stand here for 10 seconds, right? Find a flat surface. I'm actually on a little bit of a slant here, but find a flat surface and just stabilize yourself. See how long you can stay. Can you raise your hand up? What can you do in this position? If you can do it for 10, 15 seconds, great. Switch legs, do the same thing. See if there's discrepancy. Right? You might find yourself more wobbly on one side, and that side might be the crux of the issue of your back pain, because remember, this area is all connected with the back, and that's why we focus on the hips and the lower back and flexibility with the back program. So you can do the same thing. You can move around, see if you can stabilize here. If you're good with just staying there, then you can try things like a cone touch, or maybe something this height. Right? And you can do it two ways. You can lift your foot up, or you can keep one foot close to the other. Push the hips back like you're doing a deadlift, so never rounding. Pushing the hips back, and go see how low you can go and come back up. All right? So that's one movement. Try to keep the shoulders back, and then switch sides. Do the same thing on the other side. And then each time try to get a little bit lower, right? To a point where you can get down and touch your toes. All right? And then from there, you can do more things like, bringing the leg back, both hands down, and then you can start to do an actual squat. So, two things I want you to take away from this. If you're in back pain, start with Back Pain Relief for Life. Once you get out of back pain, then move to the next level, which would be strength training for the muscles that support your hips, your lower back, your legs, and continue to expand upon the Back Pain Relief for Life program. So the two things you can do are the one-legged standing and moving, and see how long you can hold it for. If you're having a hard time holding it for 15 seconds, just practice that and do it until you can hold it for 15, 20 seconds while moving. If you can do that easily, then do the next thing, which is the toe touch, or going into the toe touch. So don't start with the toe touch if you can't correctly hip hinge by pushing your butt back and reaching, a foot or two below above the ground, let's say. So those are the two things I want you to start with after you've done the Back Pain Relief for Life program, and it will help tremendously with stability of the hip, the knees, and the ankles. So all of these are directly affecting the lower back. Go ahead and give it a shot.